Hi there, it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
Okay, so yeah, tonight we're going to have a bit of a chat about the changes and the adjustments and the impact that a diagnosis can have on someone. And there are lots of things that can happen when someone is diagnosed with a chronic illness or any condition. It can have a massive impact on someone's life. So it's definitely something that's worth talking about and being aware of how it's impacting you. And particularly as well, when we look at diagnosis, uh, obviously there's medical interventions or physical interventions, but we also need to consider uh, emotional interventions and uh, the emotional impact it has as well, which can be considered to be just as important as the medical intervention. Okay, so to start off with, I just want to go over what it actually means to have a diagnosis. So a diagnosis is a way of defining or determining a disease or a condition that explains a person's symptoms or set of characteristics. So usually when someone is diagnosed with a condition, it usually means they have to meet a criteria of those characteristics or symptoms. And that requires a medical or health professional to confirm the diagnosis through uh, the appropriate testing and screening, um, and it might require other people uh, to confirm as well. Um, but it usually has quite a structured approach, and you need to meet a certain criteria to receive a diagnosis or to confirm it. These days, it's very easy and tempting to jump online and ask Dr. Google or put in your symptoms, and it will tell you, oh, you could have this, or fill this questionnaire out, and this is what you might have. And sometimes those screeners can be useful, or they can inform someone to then follow up with their doctor. But we want to be, I guess, really cautious not to rely on those screening tools or Dr. Google to confirm a diagnosis. Diagnosis also is a way of providing a label or name to something, to what someone is experiencing. And for some people, this is quite important because when you're experiencing different symptoms for a long time, it can sometimes be quite frustrating or confusing and anxiety provoking. And having a name to it or having a label to it can provide quite a lot of relief, and it helps make sense of what someone's going through. So sometimes having a name or a label, or just a definition to what you're experiencing can actually help you just feel a bit better about it. A diagnosis can be categorized based on how severe the symptoms are or how long they have occurred for. So again, a diagnosis sometimes isn't always black and white. There might be different ranges or categories or spectrums of a diagnosis. And sometimes the diagnosis isn't always permanent. Sometimes people might be in remission, or it might be for a short period or short episode. So that's something to be mindful as well, is that when we've received a diagnosis, it's good to clarify what it means for your future and the treatment implications and how long that will be for. I kind of touched on it already, but a lot of symptoms will overlap with different conditions, and a diagnosis can provide clarity with that and helps with eliminating or ruling out other causes or these other conditions. And that's called in the medical world differential diagnosis. And that's where they will, you might tell your doctor, okay, these are all the things I'm experiencing, these are my symptoms. And the doctor might go, oh, okay, it could be this, it could be that. How long has he been experiencing this symptom for? When does this happen? And they might ask you lots and lots of questions. And whilst that can feel draining or repetitive, and you might have to go to a different specialist, or you might have to get another test or X-ray, or a lot of back and forth. And a lot of the time, they're doing that to rule out other causes or other conditions to really be confident in the diagnosis. And then lastly, so having a diagnosis can really help them know how to treat the condition. And once you categorize it, or once you label it, uh, doctors or health professionals can then use the recommended treatment for that condition. That's usually evidence-based, or it's been researched for those set of symptoms. Okay, so when you receive a diagnosis, uh, there's lots of different feelings and thoughts that someone goes through. And I just put up some of them here, but I'm also curious if there are any others that the group here may have experienced, or someone else that has experienced. And feel free to put that in the chat as well. Um, oh, so some of them include feeling confronted. They might feel a sense of shock. They might, again, feel a huge sense of relief, get clarity, gives them an answer. Uh, they might also experience stress. It might heighten their stress and anxiety. They might have a sense of confusion, or, now what? What do I do with this? Which can lead to a lot of worry. Uh, it might lead to someone feeling hopeful that there is now an answer to what you're experiencing, and you can now be on the path to recovery and get the treatment. Uh, you might feel a sense of surprise, sadness, uh, anger is a common one. Bittersweet could be a mix of positive and negative feelings. Uh, and I've also put denial there, which is an interesting uh, experience to go through. And denial in this context is associated a lot of time with grief and loss. So you might receive a diagnosis that means that you have lost something, or means that you are restricted in doing something. And usually when someone goes through that, depending on how much it impacts you, some people might experience that grief process. And part of that is a state of denial, where it's so overwhelming that the initial reaction we have is that we don't want to feel or think about it. The only way to cope with it is just to uh, feel that I have to just deny it and avoid it. I'm just looking at the chart. Yes, a grief, fear, common one, disbelief. Yeah. Okay. So when you receive a diagnosis, there are usually some positive aspects to it, but there's also might be some challenges or uh, some cons to it. So I'm just going to quickly go through each one, and you might be able to relate to some of these. So pros can be, as I said before, it can help you have a great understanding of your experience. You can feel empowered. It can also help explain behaviors or symptoms, and it can be now seen as a symptom of a condition. Uh, so that might be, if you've got a behavior or a symptom that you've had for a long time, and you've always been unsure what the cause is, or maybe people haven't believed you in the past. or they've dismissed it or minimized it. A diagnosis can have that. When you receive a diagnosis as well, it can be quite validating. And for a lot of people, when you feel validated, you then feel better about yourself and a bit more empowered and a bit more control over your experiences too. It can help others understand how your condition affects you. So, what I mean by that is that when you're experiencing certain symptoms or behaviors related to the condition, other people might not understand um, how it's really affecting you. And so a diagnosis can help other people make sense of it and give them clarity too as to what you're going through. It also leads to more effective treatment sooner. So sometimes treatment can be applied without a diagnosis, but once a diagnosis is received, it's a lot quicker to then treat. For some people as well, a diagnosis may assist with additional funding allocation or their financial circumstances. So this might include MDIS and also might not apply to many people here, but a lot of diagnoses are required for schools and learning conditions or other behavioural problems occurring in those sort of settings. There are some cons. So when someone experiences that sense of denial that I was mentioning before, sometimes that can lead to a person disengaging and withdrawing and not receiving the treatment straight away. It might lead to heightened stress and anxiety, which can have other implications in your life and your body. And also then related to that stress and anxiety might then lead to making some really tricky and difficult decisions around your future and some changes that you might need to make, which can be quite stressful if it's related to your family or your partner or your work. Sometimes as well, unfortunately, a diagnosis can make people feel judged, and some diagnoses there could be stigma associated with it. So there is that fear then that if I've got this diagnosis, if I share it with people, I might be misunderstood, or I might get judged, or I might be perceived that I'm now, I might be perceived differently, and I won't be seen, the same as I was before the diagnosis. Something else to be aware of is that a diagnosis will not guarantee that the problem will be automatically fixed. So sometimes people will seek a diagnosis purely to, I guess, fix what they're feeling. And sometimes when you receive a diagnosis, the treatment will fix the problem, but sometimes it might not be what you expect, or you might have to go on a different path that you were expecting. So again, a shift of expectation may be required. Okay, so I'm now going to have a bit of chat around some of the things that we can start to do after we've received a diagnosis and how we start to adjust to these changes. So a big one is trying to reduce the distress that it's causing us. So I've just listed a few things here that can help with that. I won't go into too much detail about these because each one, I guess, could have a whole talk in itself. But some of them include relaxation strategies, so engaging in activities or behaviors that are relaxing for the body and that is not increasing the stress related to the diagnosis. And again, that could be anything to meditation, breathing exercises. It could be going for walks. It could be watching a movie. It could be getting a massage. could be exercising. So whatever you find relaxing or good for the body. Practicing gratitude. So when we receive a diagnosis and it has an impact on our life, sometimes that will be so overwhelming that we forget to see all the things that we still can do that's not related to that specific diagnosis. So it's sometimes good to just to have a pause and to reflect on what am I grateful for? What do I still have in my life that I can use? What am I still thankful for? Um, could this situation be actually a lot worse? And what do I still have in my life that I can still use day to day that can be still good for me? Other things include connecting with your faith or spirituality, um, allowing yourself to feel the emotions that you're feeling. And that's important because if we deny ourselves those feelings, again, we are maintaining that denial and could continue making us feel sometimes that we don't feel strong enough to cope, or we feel like it's too much. So allowing ourselves just to feel what we need to feel is important. Even if you can't fully accept the diagnosis itself or the treatment, it's okay to let yourself just feel what you need to feel. And again, that could be sometimes the uncomfortable emotions like sadness, grief, anger, anxiety, uh, and feeling those things helps us process the diagnosis too. Engaging in healthy habits and distractions. So again, it's about engaging in activities that that will be healthy, but also enjoyable and good for your self-care and distractions. So things that help take your mind off it. So let's say you've had a really busy day, going to appointments, or you're just thinking about it a lot. It's having you think about some things that you could maybe implement during your week or your day that could help just take your mind off it for a bit, and that it's a healthy behavior for yourself. Support planning is another important um, aspect of this. So having a think about who is in your support network and who can I talk to, who can I contact, who can I spend time with that can be supportive of me and that can understand maybe what I'm going through as well. Don't judge yourself. So allow yourself to feel these things without judgment. There is no such thing as an abnormal emotion. All emotions are valid to feel, and everyone has their own reactions to this. So no emotional response or emotion that you're experiencing from this is wrong or abnormal. Everyone will have their own reaction based on their own circumstances and their own life experiences. So that's important to not judge yourself for that. And also just practicing some self-compassion with this and try not to punish yourself when going through this or beat yourself up. Being kind to yourself, it's being gentle to yourself. Getting a diagnosis can already be life-altering or stressful, and we don't need to put further stress by punishing ourselves or uh, blaming ourselves or having negative thoughts related to that. Building resilience. So resilience is a big word, and I'm sure a lot of you have heard of this before. Um, Resilience can be applied in lots of different settings. I guess in this setting, when we have resilience, or when we build resilience, we have stronger capacity to cope with discomfort and adversity. So resilience helps us tolerate and adapt. It helps us accept the things that are out of our control. It helps us take an assertive approach rather than passive. So what that means is that when we experience, these problems or conditions, we can take action and we can be, I guess, motivated to make changes for ourselves that we can control. It helps us with our productivity and our overall sense of well-being. It shifts our thinking from avoiding and surrendering to more acceptance and tolerance. So again, sometimes when we uh, receive a diagnosis or when we are going through treatment or going to appointments, it's hard work and it's exhausting. And sometimes it is very tempting to just give up and surrender and just to avoid um, and to just pull back and not go through it. Sometimes as well, that can mean that we can sometimes get a bit stubborn. And that sometimes looks like, again, denial or minimizing the problem and not wanting to face the reality of the problem or the condition that you're experiencing. And again, that is just purely a coping mechanism. And because the reality of, that conditional diagnosis can be really scary or, overwhelming. We don't want to fight the discomfort or push it away. And again, if we do, the discomfort or the stress increases. So when we are focusing on our own strengths and our own skills and our own inner resources, that is when we're able to build that resilience and our own belief in ourselves that we can get through this. And it's tough and it is exhausting and it will test our patience. But I can get through it. I have certain strengths, I've got certain skills that I'm still capable of implementing. I guess as well, one of the main things with this whole talk is allowing ourselves to be vulnerable. And when we look at, facing these emotions or facing the impact of a diagnosis, it does mean that we have to accept that we have to be vulnerable, and it sometimes is a reminder of our that we're human, and no human is perfect, and we can all face these conditions in our life, and all humans can feel vulnerable at times. So again, I think it's okay to feel vulnerable and allow ourselves to express that. And vulnerable does not mean that you are weak or faulty or that things won't get better. Again, it's allowing yourself to feel what you need to feel and being honest with yourself with that. And then with that vulnerability, it's reaching out for support. And if you have people in your life and you can look at those people that that have good supports in place, they will tell you how much they mean to them and the importance of having those connections when going through a tough time. It's important as well to consider what types of supports you do have. So this may include your close relationships or personal supports, but also the professional types. And that for some people might include, talking to someone about your mental health and talking about your emotions, seeing a psychologist. Your emotional responses to a diagnosis might be related to how you respond to other things in your life. It might be related to other life events that you've gone through. It might trigger certain memories in your life as well. So if you're noticing, that you're experiencing this strong emotion and you're having difficulty processing them, accessing that professional support is really important.
So you've just finished watching part one of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. But otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.